Assalamu alaikum. Hello, everyone. Today, we will discuss a very important comparison between PLAB pathway and USMLE pathway. Now, I will give you an overview for both pathways. While PLAB, you can go to the United Kingdom, UK, while USMLE, you can go to the USA, United States of America. So whatever the pathway you want to go through it, I will clarify for you all points needed for them. Initially, what is PLAB? PLAB is the Professional and Linguistic Assessment Board. Professional and Linguistic Assessment Board. This pathway will give you advantage to go into residency program at the UK. So you can go into residency program in the UK, whatever your residency, either surgery or internal medicine. Both pathways you can enter through Professional and Linguistic Assessment Boards. You can work at UK after you fulfill the GMC criteria. But what about the USMLE? The USMLE, it is the United States Medical Licensing Exam. United States Medical Licensing Exam. Here, it can give you the advantage to work as a resident and to go into residency program at the United States of America. And here, this USMLE has 3 parts. Step 1, Step 2, which is 2 parts, CS and CK, clinical skills and the clinical knowledge, then Step 3. And I will clarify each step in this video. Then regarding the PLAB, exam before the PLAB is mandatory and it is usually required. So you should go either OET or IELTS before the exam. And now OET offers a validity for 3 years, while IELTS offers a validity for only 2 years. But regarding the USMLE, no need for IELTS exam before it. No need for even IELTS exam before it. Then some points regarding the PLAB. PLAB is formed of 2 parts, part 1 and part 2. Asked in 180 single best answer questions, and it is a written exam. While PLAB 2, it is just objective structured clinical examination. It is just OSCE exam, 18 stations. And here you can go for part A before part B, no part B before part A, like Mrcs. And here in PLAB, just a pass is enough. No need for higher markers. So here again, 3 points regarding the PLAB. PLAB 1 is single best answer written exam, and the PLAB 2 is OSCE exam, just 18 stations. Then part 1 should be given before part 2, and just a pass for PLAB is enough. What about USMLE? Here you can go into 3 steps. Step 1, which is the single best answer, and it is a computer-based exam, and this is just about 280 questions. Then step 2, CK and CS. CK, which is the clinical knowledge, also single best answer, computer-based formula, and this is just 318 questions. Then regarding step 2, which is CS clinical skills, you will go into OSCE exam, objective structured clinical examination. You will go into stations, and this is a patient-based exam. Here, another principle about USMLE, that you can go for step 2, CS or CK before step 1. So here, if you want to enter step 2 before step 1, this is available. The third point is that score is very important for USMLE, as it gives you higher in working and into getting to the residency program at the USA. So here, high scores gives you advantage over other candidates. Then time needed to prepare each part. Here, in both parts of PLAB, you can finish them within 8 months to 1 year. While PLAB 1 can take 6 months and the PLAB 2 can take 2 to 4 months. And this is different from USMLE because USMLE is just a long pathway, while step 1 will take preparation for about 1 year. While step 2 CK can take preparation for 6 months and CS for 3 months, and you can add over them step 3 may take from 3 to 6 months also. So this is all time needed to prepare. So you can prepare yourself that you will go into rigorous preparation for 2 to 4 years regarding time of preparation. So 2 points discussed, overview in PLAB and overview in USMLE. Here, which is easier, as you see, PLAB is easier than USMLE, and time to prepare, while PLAB can take from 8 months to 1 year, and USMLE can take from 2 to 4 years. If I fail in the exam, so how many times I can repeat the exam? For PLAB, you can go for exam up to 4 times. And you can take the 5th time after GMC permission, which is General Medical Council permission. But what about USMLE? You can repeat the exam up to 6 times. Timing after each one, validity for each certificate of them. After you go into the occupational English test or the IELTS, when you have a validity for 2 years, you can go into PLAB. Timing between PLAB 1 to PLAB 2 is 2 years, and the timing to apply into GMC registration after PLAB 2 is also 2 years. But what about the USMLE, which can give you a validity for 7 years? Very important for all, it is the cost. As all of us know that PLAB is cheaper than USMLE. Cost of PLAB, you should go into occupational English test before, and it will cost you £332. Then PLAB 1, £239. Then PLAB 2, when you have to pay £875. Then you will go into portfolio verification through EPIC. Then you have to pay £176. Then GMC registration process will take £156. So this is all you need to get your GMC registration after the PLAB pathway. While the USMLE, you have to apply first for ECFMG. So this will cost you $145. After it, step 1 and step 2 CK, both of them will cost you $965, and step 2 CS, which is the clinical skills, will cost you $1,600. Then step 3, $895. Then you will go into ERAS and the EPIC portfolio. ERAS $130 and the EPIC $215. So overall charges needed to pass the USMLE can be around $5,000. So this is the USMLE. Then now, what's your pathway after you pass the PLAB? You will go into the GMC system, and you have 2 pathways. First pathway is training pathway. Second one is non-training pathway. So training pathway, you have here a very important program and that you have to fulfill. And you will go into years of training. If you want to skip in year of training, so you have to prove this to the GMC. What about the non-training pathway? Take care. No need for cost to apply for any job at training or non-training program in UK. And take care also, you will be paid whatever you have entered the training and non-training pathway. Which is easier to get? It is non-training pathway. As in the training pathway, you will have many comparative studies between candidates and you have a great wide-based competency. So do not worry, either training or non-training program, you will get into the GMC procedure. After USMLE, what's your pathway? You will have to wait for the training posts in order to match with many of the criteria needed, and usually is done in a 1 month annually. Usually in November, they are announcing for a training post, so you can apply and match, then you will go into the USA. Here, all will go into training program, no non-training program in the USA. And also, no one can go into the USA without residency. And you should match the criteria needed in order to work there. Then, last advice for you all. Choose your pathway clearly. Either you want to work in the USA or the United Kingdom. Keep struggling. Do not hurry about your pathway. Many candidates have passed and now are working in the UK and the USA as a resident, then registrars and consultants. Overall, paid salary for you after you pass a PLAB and you pass USMLE, you will take in the UK around 30 to 65,000 pounds per year. While in the USA, you will pay it from $70 to $290,000 per year. So here, this is also a good salary in the USA more than the UK. Hope that this video will clarify all points for you regarding the USMLE and the PLAB. Do not forget at the end of this video to follow us and subscribe our video, The Surgeon Dr. Hesham. Thank you all, see you and goodbye.